Basic life support is one of the first things that you learn at medical school, but it's also a really useful skill to have in life generally. You might encounter an unconscious patient on the ward when a nurse hasn't been to visit him for a while, or it might just be somebody who's collapsed in the street that you might need to administer some care to. Now, it's important to remember when giving basic life support the acronym Dr. ABC, that's DRABC, and each of those letters stands for a certain thing that you have to do in that order. So the D stands for danger, and it's important that you check that there's no danger to you. So a patient may have collapsed, but it may be because there's been a car accident, and there might be a risk of a further explosion. If you enter that situation, you could be putting yourself in danger, and that's not what you want. So first, assess the situation for danger, and if there isn't any to you, it's okay to proceed to R. R stands for response. So a patient might look like they're unconscious, but in fact they might be asleep. So it's really important to check if they have any response. So all you need to do for that is to shout at them and ask them their name, and maybe touch them on the shoulders to see if they respond to that as well. Mr. Dornan, can you hear me? It's important to speak loudly and clearly, and if you know the patient's name, you can use that as well. So that's the R. Now there's been no response, so the next thing is the A and the B, airway and breathing. Now the airway is the word doctors use to describe the pipes through which we breathe. So every time you take a breath in, it goes in through your mouth and down through your windpipe or your trachea into your lungs. Now a patient might not be breathing because there's an obstruction to their airway, so it's important just to have a look in their mouth, open their airway, and see if they're breathing or not. To do this, we do what's called a head tilt chin lift. So you tilt the head back and lift the chin up, and that opens out the airway. It's as if you're stood up like this, and it's much easier to breathe that way. So head tilt chin lift, which opens the airway. You can also look at this point to see if there's any obvious obstructions to the patient's mouth, but don't put your fingers inside, because they might bite. Once you've opened the airway, then you need to assess their breathing, and we do that by looking, listening, and feeling. So you look to see if their chest is rising like it does when you breathe. You're going to listen with your ear, and you need to get down really low. And if you put your cheek right next to the patient's mouth, you'll be able to feel if there's any breath coming out of it. So look, listen, and feel, and do that for 10 seconds, like this. Head tilt, chin lift. And you'll look, listening, and feeling for 10 seconds, and make sure you count for 10 seconds. Because if a patient's collapsed, their breathing might be slow, and it's important that you don't miss a breath. Now, if the patient's not breathing, the next thing you've got to do is get some help. It's no good starting CPR, because if you're just on your own and you haven't told anybody, nobody's going to come to rescue you and the patient, so you'll be going at it forever. If you're on a ward and someone's collapsed, it's really easy because you're surrounded by lots of healthcare professionals. So to get attention, you just need to shout. If you're outside on your own, it might be that you can use your mobile phone to call the emergency services on 999, or you might actually have to leave the patient to go and summon help. Now that's appropriate to do so, because otherwise you'll be stuck there on your own and help won't be coming. So we're up to the B. The next thing to do is the C. If the patient's unconscious and is not breathing, you've got to start basic life support, and that's basic resuscitation. So you start immediately with 30 chest compressions. Now the way you do chest compressions is by interlocking your hands like this. So you put one hand on top of the other and clench the fingers. Then you use the palm heel, or the base of your hand, on their sternum, which is this hard bone right in the middle. So interlock your fingers, place your palm heel on their sternum, and then get high above the patient. Lock your elbows and rock backwards and forwards. Now you're doing this at 120 beats per minute, which is actually quite fast. There was a study published recently that said if doctors used the song Staying Alive by the Bee Gees in their head, that's the appropriate rate to do it at. So I'll demonstrate that at the right rate, and then start singing the song on top of it so you can get an idea of how fast you've got to go. So, interlock your fingers on top of the sternum, lock your elbows, and I'll let you overlay your own song actually, because my singing is atrocious. Make sure you're counting, that's 20. And when you get to 30, that's when you stop, and now you have to do the breathing. So you need to breathe for the patient, and this involves mouth-to-mouth resuscitation. First, you need to open their airway again, so head tilt, chin lift. You're going to be breathing for them, so it's important that you've got a mirror of breath. So you take a breath all the way in, and then you're going to be breathing that out into their lungs. It's important to pinch the nose, because if you blow into their mouth, it could just come straight out their nose without going down into their lungs. So take a deep breath in, head tilt, chin lift, pinch their nose, and then breathe slowly and steadily into their mouth. And you should see their chest rise. I'll show you that now. Now you do 2 of those per cycle, and then you go back to your 30 chest compressions. So it's 30 chest compressions, 2 breaths, 30 chest compressions, 2 breaths, and you keep going. It can be incredibly tiring to keep doing that. So if you have somebody with you, it's good to swap jobs occasionally, maybe every 2 or 3 cycles, to make sure you're doing the chest compressions to the best of your ability and providing the best life support you can. When the ambulance arrives or another healthcare professional arrives on the ward, make sure you change your role so you're not in charge of the resuscitation anymore, to keep everybody fresh. Good luck.